Welcome to the Scottsdale Top Docs podcast, where we share a mission to improve access to care and prevention, as well as planning for the future. Our goal is to help people live healthier, happier, more informed lives. We believe that healthcare isn't a job, but a calling to serve, and the best care begins with conversation. Now on to today's episode. Hello and welcome to the Scottsdale Top Docs podcast. I have the immense pleasure today of introducing you to Dr. Richard Brown. He's a plastic surgeon here in Scottsdale and my guest today. Actually, Dr. Brown, I wanted to first just talk about social media. There are not a lot of physicians, even in Scottsdale, that have the kind of following that you do. And just looking at your profile. So the first one that has the most attraction is essentially your TikTok, which is the real TikTok doc.
That's right.
And it's essentially you like kind of giving feedback on all these different things like GLP-1s on people that may or may not, require them, and surgeries that doctors do, and just like your honest reaction. Was that always your end goal, is to just like give your honest reaction?
Yeah, I think my general rule on social media has always been educate, inspire, entertain. People want to be entertained to some degree. But also want to educate people about what I do for a living and try to guide them and give them the best chance to make the best decision for themselves. And so TikTok started out mostly plastic surgery. And then as graphic content kind of got banned, it parlayed more into just general medical stuff, since I'm general surgery trained too. But that's really been kind of my modus operandum.
I'm always kind of intrigued by people who have both a hand skill set, a mind skill set, and an entertainment skill set. It means that you have a mind quite unlike other people. I think of those people more like Robin Williams, where they don't really understand how they're doing it, but they're capable of doing it. And a certain level of genius is applied to that for me. A lot of people are more capable of learning things than they realize. They may just not have the focus and the attention to do it. So I just want to applaud you for that, because it's a real skill set. And I actually heard your interview before this and learned that you do it all yourself, which is, not that you don't have people that help you and support you, but creating that content, it's time consuming. You actually have to go into the really creative side of things. And I can only imagine running a business, having a family, and then also being required to do all these things. Sometimes it must feel overwhelming.
It is. It's very overwhelming. And I've been in kind of a burnout phase for about 6 months or so now, but I still love it. You have to enjoy being on social media, or you won't do what I'm doing. You won't be successful. So I think for me, authentically, the way it all started was, hey, I want to reach people and educate them and help them not get botched, whether they're coming to me or not. So for me, it was always this authentic way to just show people the world of what I do and why I chose it. And I think when you approach it that way and you don't see it as a job, like I have to do this to get patients and make money, that's never been my goal. I think if you just take the authentic sort of educator route, that's when things start to happen.
Okay, not to be like a super fan nerd, but so I heard you have a million followers on YouTube.
Yes.
What's your TikTok up to?
TikTok is at 7.7 million.
That's like a wild number. It's fairly unfathomable. I just think of people from LA and movie stars and stuff, but it is what it is. How has that changed how you view yourself? Does it make you feel more responsible for the content that you put out? Or does it make you feel good about being able to delve into different areas?
Yeah. No, that's a good question. One, it is awesome being able to, as a medical professional, being able to not just talk about plastic surgery. There's a lot of basic medical things that I understand that I'm able to hone down and dumb it down for the general public to understand. That's something I feel like I'm good at. So that's been really awesome. And so I think that, the platforms for me have really been nothing more than just fun and entertainment. And so there are times, your question about, you have to be careful about what you post. You do. There have been times when I'll post stuff, my wife's like, you probably ought to take that down. And I'm like, really? That was funny. You don't think that's funny? She's like, yeah, but you probably ought to take that down.
That's funny.
So I miss the mark sometimes on certain things, but for the most part, I just believe in my message and whatever it is I'm posting about, and I just let it fly, and whatever happens, happens.
Okay, so a little bit more personal. Tell me about your wife.
Yeah.
Maybe tell me a story about, how this came to be. And I know you actually have 15-year-old twins, right?
We do, yeah, twin boys, Brody and Graham. My wife, Alexis, so we met during my residency training in general surgery. So we met online. So we met on a dating site.
What?
Yeah. So JDate was the site. I think Match.com owned JDate at the time. And so my mom wanted me to marry a Jewish girl, and her parents wanted her to marry a Jewish boy. And while religion, I'm not deeply a religious person, it was more to appease our parents, like getting on those platforms. So long story short, an ER doc was rotating through trauma surgery with me on my service when I was in Chicago at Mount Sinai. And he was like, "Oh, you're on JDate? Like, I'd love to get on and see some people. Like, have you been out with anyone?" I'm like, "No, I haven't been out with anyone, but sure, let's jump on and look at some people." So we were kind of messing around, and I was like, "Oh, I bet there's some cute girls in Vegas, or Australia, whatever." So we were looking on the Vegas website or wherever, however you get to those people there. So I saw her profile. I was like, "Oh, that girl's really cute." And I didn't really think anything of it. And I kind of like looked at her profile and just kind of kept scrolling. So I got an email or a message from her like 2 or 3 days later, like, "Hey, I saw you looked at my profile. I would love to, talk sometime."
Wow.
And at that time, DMs weren't really a thing.
So this is a bold
We didn't
woman.
really have phones that were, so it was pretty crazy. So to really make it short, we end up talking. I'm in my research year, between my 3rd and 4th year of general surgery training. And I was going skiing with a friend, and I had some time, like when I got back before I had to be back in the lab. And so we'd been talking for about a month, and I was like, "Hey, why don't I fly out to Vegas, and I'd love to meet you." We'd been talking on the phone for about a month or 6 weeks or so at this point.
Oh, that's
And
awesome.
yeah, and at that time, I wasn't really dating at all because I was working so hard in the hospital. So I end up going to meet her. We take ourselves off JDate. We kind of flew back and forth that year, just kind of tried the long distance thing. I kind of knew that she was the one almost instantaneously.
Wow.
And about a year after I met her, well, less than a year, she moved to Chicago, and she was going to be moving without a ring. God bless her. I was never going to let that happen, but she had committed to moving without a ring. And so I got a ring, and I flew to Vegas. And before she moved out, I proposed, and we moved, and the rest is history.
That is so sweet. First, your wife is bold. Second, you're a good man for not even putting her through that, but knowing what you were looking for.
Oh yeah.
That's so cool.
Yeah,
I love
it's a cool
that.
story. So, and we've been married for almost 18 years now, and
Congratulations.
super in love. She's an amazing human being, and our kids are awesome. And
Listen to this guy. Oh my gosh. Okay. Well, so family man,
yeah,
business owner,
yes,
board certified plastic surgeon.
yep.
How do you do this? Do you go home and feel successful at home? Do you go to work and feel successful at work? Or do you just like sometimes feel like, whoa, what am I in?
A little bit of everything. I mean, I think as a person who pushes themselves pretty hard, and my wife is the same way, I don't ever feel totally successful. There's times where I think it's just part of the entrepreneurship journey of I should be doing this, I could be better at this, but in giving myself a little bit of grace and looking back at where I came from, because there is a whole other story about how I became a doctor because I wasn't supposed to be here. It's a long story, but how I ended up in medicine. But I think we always sort of tend to overshadow what we have accomplished. But no, I'm really happy. I'm really proud of myself. I've come a long way. I'm thrilled to be a plastic surgeon, and to have the woman that I have in my life. It's all pretty incredible.
Well, thank you so much about opening, some personal doors. I really
Yeah.
appreciate that actually, because even to me, you just feel like a real human. And I think that a lot of times, even on Scottsdale Top Docs, people feel like doctors are a different level of
Mhm.
people that aren't really humans,
Mhm.
like they're part computers or something. And so it's really important actually, and it gives people walking in the door a realistic view of like, hey, this is a guy that has a family, and this is a trustworthy person, and it's
Mhm.
an authentic person. And speaking about authenticity, so you're the third plastic surgeon that I've interviewed total.
Cool.
And I have questions about plastic surgery and how people feel about it. Because when I was growing up in a conservative environment, um, it was like frowned upon. Not like frowned upon. It was Why would you do that to your body?
Yeah.
And now it's so commonplace, and it seems that it's an enhancer of what people can do, how confident they feel. What do you think the benefits are? And are people finding ways to be more authentic in themselves? Or do you still feel it's something that people are doing because they don't feel whole? Or do those things go together?
I think those things go together. So, we were talking a little bit before this about sometimes commenters will make comments on posts about, why can't you just love yourself the way you are and the way God made you? And I think what people don't realize is that just because someone comes to us to alter something in their body doesn't mean that they don't love themselves. It doesn't mean that they're not happy with who they are. There's just certain things that are changed after you've had babies, because most of my clientele are women and most of them are moms who've had kids, and you can't exercise loose breast skin away. It's never going away.
Right.
And so I think that where a lot of people in society miss the mark on cosmetic surgery, that number one, it's none of your business. It's up to the person to do what they want to do for themselves.
I love that. Way to be an advocate for your patients.
Yeah. Why should you be the one to comment about what someone else does, right? And so the more we don't really see the extreme plastic surgery stuff that you see on the show Bosch and that you see in Hollywood. Most of us don't do that stuff.
Right.
I'm taking care of run-of-the-mill people who don't like the way that they feel after having a kid because of loose skin or something that just they don't feel feminine and whole in their body. And why shouldn't you do something for yourself? Because what I tell people all the time is the way that you feel in your body translates to your relationship with your special person, to how you are with your kids, to the way you handle your job. When you feel your best and you feel healthy and you feel beautiful, you're your best that you can be in life. And why wouldn't you do that? Why wouldn't you want to do something like that? So while surgery is not for everyone, and I am totally fine with that, I think the people that choose to do stuff and they're doing it for the right reasons, you should do that. You should feel as the best that you want to feel.
Efforts like physical therapy pay great dividends when it comes to improving the range of motion, when it comes to improving the quality of a person's life.
You know how to change the way of life of people, which is a wonderful thing to do, to know you're doing that. Because I'm sure that without your help, I can do more than I thought I ever could. It's very important to have a way of moving around. Maybe you're not doing much of the moving, but you're moving. And I give you an A+. So I appreciate you very much. And that's the truth.
So I love that your primary population is like mothers, because it's actually really well documented that new moms are one of the most neglected populations. Essentially, they're feeling guilt about how their body feels. They're feeling body shame every single day. They're proud that they're a mother. They're exhausted. They're not feeling like themselves. They're essentially, constantly giving to this new life, and not just like changing diapers, but giving of their own body and their own energy and their own sleep and all of what they are. Their brains are not operating correctly. That's also well documented. Like even sleep deprivation. If you've ever gone many hours without sleep, you could maybe be on par with a new mother, maybe.
Yeah.
And then also just their health needs are actually secondary, tertiary to everyone else in the house, and they feel terrible about complaining. And I feel like there has to be so much that we can do in healthcare to pay more attention. But one of the things that I actually see often is like just simply rectus diastasis. A baby grew inside your body and all of a sudden your muscles literally separated, and it's basically like a hernia, and I don't know why, but some people give really terrible advice about like, well, they're not working out enough. They need to lose all this weight. And you're like, that's not just generally going to go back together unless it did right away. And it's occurred over months. And so, when people come in to do this, is that a primary surgery for you, this mommy makeover? And when is the appropriate time for them? Is there a certain amount of healing?
Yeah.
Are they supposed to be going through weight loss? What do they do?
Yeah. So all great questions, loaded questions. Let's just talk about a mom who maybe wants to tummy tuck or to do something with her breasts.
Mm.
When should she do that? And what is the whole process of making you the best candidate to have surgery?
Mm.
So in general, I try to tell patients, you shouldn't have a tummy tucker or do your breast surgery until you're done having kids. So that's number one, right? Because all the changes that occur with pregnancy are centered around stretching skin, and we're
And they're gonna
trying to
do it
get rid
again.
of stretchy skin. So you should try not to do that. Now, I have plenty of women that'll have a breast augmentation, years before they have kids. And that's okay too. If you know that you're not going to have kids for a while, as long as you understand that there's going to be changes. So the first thing is that mom should kind of be done with having kids. For the breasts, we like to wait a certain amount of time, a few months, maybe for the milk to go down when they're done breastfeeding in order to do breast surgery. So in general, plastic surgery should be your last resort. And I tell everyone that you should maximize your meal plan and your exercise programs before you even think about having surgery. You want your body to be in the best position to obtain the best result.
Mm-hmm.
So sometimes patients will come in and they're still carrying a little bit of too much weight and their abdomens are really bulgy because they have visceral fat, the fat that lives around their organs. And I might say, hey, now's not the time for this reason. I'm not going to be able to make you as flat as you want to be. We still have a little bit of weight loss to go through. It's not a skinny versus fat thing. This is just a getting a good result thing. And so I'll counsel patients when that time is right for that. But once all of those I's are dotted and the T's are crossed and their body's in the best place and they've maximized working out and they've maximized their meal plan and they just have loose skin and they want to be fixed, now is the time to talk about surgery. And so I'm always assessing their mental status, where they are mentally. Are they doing it for themselves? And is now the right time? So that's kind of a general guideline of if someone comes to me, the things that I'm going through in my brain to determine whether they're ready for surgery or not.
And one of the big ones that stood out to me right there was they're done breastfeeding.
Yes.
And so that can be also a little journey for women as well.
For sure.
When they come in to consult, if you know that right now is not the time for them and they're just very upset, are there other resources that you're giving women who are coming in that aren't ready for the surgery, but like are clearly struggling maybe with like their overall internal feeling?
Yeah, I love this question. So a few years ago, not a few, probably 5 or 6 years ago, I found myself counseling patients about nutrition and losing weight and why it was important to do that before surgery if they still needed to. And I would send them off and tell them, hey, come back when you're there and we'll talk about surgery. Knowing fully they were probably just going to go find someone who would say yes to them down the street. And so I started to think to myself, why am I doing that? Why am I not providing these women with an internal thing in my practice that can maybe help guide them through that without losing them? So I came up with an idea for a part of my business that's basically a wellness center within the practice. And so part of that is mental health. So I have a lot of women that come in that I know mentally aren't ready for surgery. There's just cues that I pick up on in our consultation. So I had a mental health specialist in my practice for a while to offer women, say, hey, listen, it's a food addiction or this traumatic thing has happened to you in your life that you're not ready to get a good result because this isn't better.
Wow.
Would you mind talking with this therapist that I have? Is that something you would be okay with? So that's number one. Mental health is huge, right? If you don't fix this, you'll never be happy with this. Even if I fix your physical, if your mind's not in the right place, you're never going to be happy. So that's number one.
I have goosebumps.
Yeah.
Let's pause there for a minute because that's actually a way bigger deal.
Mhm.
And we think about that with everything. I mean, I'm a physical therapist. And sometimes people aren't even willing to accept that they could stand if I put them in that position.
Mhm.
The pain feels overwhelming, but we're just literally like, sit on this for a minute. We're going to do it together.
Mhm.
Right. And you're literally telling people we can get there, but we have some steps we have to take.
Yeah.
Right. Let's address this, but we're going to do it together. I think that is actually a direction that healthcare has to go, because before doctors used to sit up here and say, this is what you have to do.
Mhm.
And then a patient would leave and you may never see them again, like you said.
Mhm.
But if you can hold their hand and not do it for them, but say, hey, the guidance is still going, you're still accountable for this. Let me help you walk through it. I just
Mhm.
think that is the future of healthcare in
For sure.
every discipline. If we're not thinking that way, we're literally abandoning patients, and we're definitely never going to be what we need to be to move forward, like to literally elevate what humanity is.
Yeah.
So I just applaud you for that piece, but please
Yeah.
continue.
Well, there's a story there for me. So there's a woman I did a breast cancer reconstruction on and had known her for years. We'd done a couple of revisions on her to fix some things. And She came to my office for almost one of the last visits that I was going to have with her. And she was overweight. She knew it. We'd talked about it before, and she desired to lose weight. And so we started talking about that. And because she was starting to talk about maybe doing something cosmetically for her body. And as we started to talk about it, and I don't know how this happened, but it came out that she'd been sexually abused when she was younger.
Oh my gosh.
And so we sort of delved into, I was like, well, do you think that potentially you've yo-yoed with your weight your whole life because you don't want to feel attractive to someone because of the risk of that happening to you again, maybe? And she started crying. And I'm like, have you ever talked to someone about this? And she was like, not really. And I'm like, well, before we even start talking about changing your physical, you need to handle this. And like we were both crying, and like, I'm like, it was like an emotional moment that just happened authentically. And I wasn't looking for that, but it just happened because I knew her well enough and was bold enough to ask her the question. And she sort of like gave into it. And so, I offered for her to talk to our mental health specialist. I think she said she would end up doing it on her own, but just moments like that, I feel like are real moments in our businesses that we have to stop and forget about the fact that we're there making money, being doctors, trying to take care of people, and really step back and think about maybe this isn't a plastic surgery moment for her. This is a mental health moment for her. And so that's just an aspect of my practice that I'm passionate about that I don't know if everyone is.
I actually saw one of your posts about male breast reduction surgery. And I think that a lot of people only think that females get plastic surgery, number one.
Yeah.
But talk to me about some of the, like, I guess the psychological things that go through with that, and maybe some of your screening processes, or if you're like, you've been dealing with this long enough, or if there's other things you have to consider when doing that. Is that a repetitive surgery?
So for men, it's gynecomastia is what we call it. That's male enlargement of the breast. That has nothing to do with weight status. It's actual glandular tissue. They have a hormone imbalance where they have more of an estrogen strong environment versus testosterone, which stimulates their breast tissue, just like women get sore breasts from menstruation. So they grow their tissue. Now, of course, this can happen from taking steroids, or there are exogenous things and medications that can cause gynecomastia, but this is a real big source of stress for a lot of men. And I see a lot of men for that procedure. And I see men for liposuction, and I even see men for tummy tucks, massive weight loss patients, things like that. So I will say that in this day and age, I feel like a lot more men are becoming more forthcoming and not being shy about saying, hey, this is something that bothers me. I can't wear a tight shirt at the gym. I don't take my shirt off around the pool. Fit men with boobs, unfit men with boobs, things that they would never, you can't lose weight and get rid of gynecomastia. It's tissue that we have to just take away. We have to cut it out. So I do see a lot of men for that. And it makes a huge impact on their lives and their confidence. Like I can see it in them as much as I see it in moms who come for mommy makeovers.
So with it being a hormone imbalance, assuming that it was that, does that mean that they're going to have a repeat surgery most likely?
No. So usually if you can get rid of all of the glandular tissue, it's tissue we can actually pinch and feel. It's different from the surrounding fatty breast tissue. They feel like little nuggets right behind the nipple areolar complex. It's called gynecomastia. We can feel that tissue. And if you get all of that tissue out, it won't come back. It should not come back.
Wow. Okay. That makes a lot of sense. I really like your messaging. I really appreciate that you're actually getting into the reality of what humans are, not just the look of what the age is. But I want to ask you, you've been practicing for about 15 years as a board certified plastic surgeon. How has plastic surgery changed over just that 15 years of your career? Can you think of anything you're like, the fad is this now, it was this, and then rapidly swung the other way?
I don't think that physically the body has changed too much. The procedures that we do and the things that we can do have changed a little bit. We've certainly seen a huge uptick in the injectables world. We've seen a huge uptick in the skin tightening world, which I personally am not really into. I don't think many of those machines really truly work. I think they're oversold and people get sold a bill of something that's not real. And so I think that the machinery and the promise of skin tightening and injectables has really grown a ton. I don't think that the boob jobs and the tummy tucks and the liposuction have changed a ton. There are definitely some better machines. Like I use an ultrasound device that's really better, I think, at removing fat and making things smoother and even. But the procedures themselves have not changed that much. I think just the way that we approach patients have changed a lot. And I certainly think the biggest change that I've seen over the 15 years I've been here is just the huge uptick in all of the injectable stuff and the machines and the muscle tightening machines and the skin tightening machines and the cool sculpting, melting, and that stuff is just out of control. There's too many.
It's very expensive.
It's very expensive and they don't really work.
I want to applaud you also on something different. So as a physical therapist, I see a lot of pre-post operative patients.
Yeah.
And I do find that the pre-op is essentially neglected quite often. People are not really sure what to expect. They're not really sure how to prepare their bodies. And a big portion of surgery is how your body is ready to receive surgery. And so I know that you have this book, but other people might, The Real Beauty Bible, Navigating Your Journey Through Plastic Surgery that you wrote. And this is essentially like a pre and post-op navigator for patients. Now, do you give this to everybody that walks in the door?
I do. So everyone who comes in for a consult gets a free copy.
Is it on Audible? And do you need me to read it so you can sell it on Audible?
Yeah, it's on Audible. It is on Audible. I wish that I had read it. I didn't, but it is on Audible and it's on Kindle as well. But yeah, this book came to fruition because I just was so sick of seeing a lot of the botched stuff that was big on social media and stories that I would get in DMs from patients. That I was like, people need a guide, man. They need a guide to go through just to kind of like help them with all the before stuff. I mean, in the first part of the book, I talk about something you touched on. I talk about post-surgery depression, moms who finally decided to do something for themselves. And then post-operatively, they're incapacitated. They can't take care of their babies. They get stressed off. They get stressed out.
Rewrap their bandaging.
Yeah. Why did I do this? I'm so selfish. I talk about that in the book. I talk about how do you approach your mental side before you enter in this? How do you give yourself the grace to say, I'm finally going to do something for me and not feel after surgery like you did something wrong? So the book was really written to sort of go through the beginning stuff, like how do you talk about finances? How do you talk about wanting to have plastic surgery with a spouse who you know probably isn't going to be cool with it? Like a lot of that stuff is in the first part. And the second part is mostly just, hey, which procedure is right for you and how do you determine that? And then third part is literally I walk people through, here's what's going to happen when you walk into the surgery center. Here's who's going to put your IV in. Here's going to ask you these questions. And then how do you live in your new body after the fact? And that's kind of what the book walks people through.
I love that. I think it's really good of anyone who has a business to set expectations when they walk in the door.
Yeah.
And if you don't, you're not a good business owner in my mind. And practitioners need to be extra careful about that because expectation is everything. And last night we actually had a friend of mine who's an internal medicine doctor, but he is an AI specialist. He's talking about AI in healthcare and how AI doesn't replace a practitioner, but what it does do is decision support. Okay, so he related it to like Apple Maps or maps on your phone. It doesn't choose the path for you, but it gives you suggestions on how to get there the fastest, how to avoid traffic, and gives you signals of things. Hey, there might be a speed cam up front. So it can tell you hints, but it doesn't decide for you as a practitioner. And so I think that it's really important for people to kind of understand that there are all these different benefits that a practitioner has that has multiple decades of experience and is really going in to treat you as a person. And it's just undeniable that technology is playing a bigger role, even in plastic surgery. Like when we look at social media and it says, I'm supposed to look like this. Do I get to decide? Well, yeah, of course you do. I get to decide to turn that one off.
Right.
I get to decide to look at this one that's like more in tune with my authenticity about how I want to sell myself. I may not have to be in this outfit. I don't have to carry that purse. I don't have to be that person. But for moms, I think they just feel essentially so alone that they need something, a little bit of help and a little bit of touch about how they can feel more like themselves. And I just am honestly grateful that they have a resource for that, about somebody who's actually looking out for their whole person.
For sure.
So I think this is brilliant and really good job.
Yeah, moms, it's tough, man. I mean, I see these women and I book an hour for every consult, and that's a lot of time to book for a consult because, I tell my staff all the time, the one thing I don't want to happen is for a woman to walk out of the office and feel like they didn't get the answers they wanted.
Mhm.
And I'll have women that are shaking before their physical exam.
Yeah.
And I can tell they're nervous when I first walk in the room. And by the time we get to the exam for their body, they're so relaxed after the conversation that we've had. And they're so excited about the potential journey and what they're going to receive. So I spend an hour with them. You can't mill people through without educating them and connecting with them. So it takes me less time to connect now than it used to because I've just done it for so long.
Right.
But I give them all an hour. And sometimes it takes 30 or 40 minutes and sometimes it's an hour and 15. But everyone has different needs. And so we're there to take care of them and make them feel comfortable.
I love it. I think you are absolutely amazing. And I'm really grateful that you came on today. If you guys want to find Dr. Richard Brown, he is the Real TikTok Doc on TikTok. What's your other handles?
Dr. Richard J. Brown is my Instagram. And then I think if you want to find me on YouTube, it's Dr. Ricky, but DOCTOR, Dr. Ricky.
All right. Well, thank you so much for coming on.
Yeah.
I'm sure we'll have a conversation again.
Absolutely.
And that has been your episode of the Scottsdale Top Docs podcast. We'll catch you next time.
It starts with tremendous confidence. And I mean, somebody who comes to this thing not as a person who's taken a class or two, but somebody who's literally got their PhD. But that alone is not enough. I would say the second ingredient that Dr. Amber brings to the party is some empathy, but also the ability to nudge people and to get them going. And then the third piece that she brings, which is equally as important, is such a friendly demeanor and a smile. And she lights up our life every time she comes.